ANANDA RUCIRA is on her way to fulfill what she believes God has sent her to do in Kenya. She is a follower of Ananda Marga, a religious movement started in India. Didi, as many call her, is the founder of the Abha Clinic in Kariobangi North, one of the poorest slums in Nairobi, the Kenyan capital. Didi set up this clinic 2 years ago to bring the people in the slum a way of healing only known to the rich in Kenya, homeopathy.
Here I got shocked to see how sick people were and how there was no money for that. People could not afford the medicine. People died not because the medicine didn't exist, but because they couldn't afford to buy it.
Homeopathy's central principle is like cures like. A natural substance that causes the same reaction in the body as the illness is used to cure that illness, but in heavily diluted form. The tiny amount triggers a reaction in the body so that it produces its own defenses against the disease. Since every individual's reaction is different, treatment depends not just on the illness, but also on the patient. It makes it impossible to test this kind of medicine in the laboratory. It either works or it doesn't.
The medicines are very, very small, and people are not accustomed to such small medicine being able to do such big cures. So they got a shock. They said it must be magic. In fact, it's not magic, it's science.
Regardless of their disease, patients pay about $3 for the first month of treatment and $1.20 for every month after that. In a country where 56% of the population lives below the poverty line, Abha Light is one of very few places where medical treatment is this affordable.
It's very cheap. Even if you earn as little as 50 shilling, you can afford it.
47-year-old Kariuki Mwangi is now a firm believer in the hospital, and not just because it's within his budget.
I tried other methods of healing, for example using herbs, typical of the Maasai community. I took this medicine for 22 months. The medicine was not helping me. That's when I started diarrheaing blood. The Maasai told me that these were signs that I was healing. Then one lady advised me to come to this hospital, and since then my health has improved.
The Abha Light Clinic doesn't only provide medical services, it also runs a homeopathy training institute in the same compound. At the moment, it has 15 students, mainly from Kariobangi and other surrounding slums.
The only way to reach the common people is to train the common people in this medicine, and that way it can spread.
As part of learning homeopathy, the students also learn yoga and aerobics, a welcome break from the formal classrooms that usually come with studying. A year ago, Morris Ajesh and his wife Jane were students in this very classroom. Now they are both homeopathic practitioners at the clinic. For them, homeopathy is a household skill.
With my children, they know I'm like this, I'm like this. So even if I'm not there, if somebody feels sick, he knows the remedy to take.
We need to have a promotional sort of, in order that people should know that homeopathy has no side effect, and homeopathy is the best type of treatment.
But the chairman of Africa's Association for Alternative Medicine is sure that homeopathy will be accepted one day.
In South Africa, where conventional doctors and homeopaths and herbalists are working from the same premises. And the patient goes and opts for whatever system of medicine he wishes to be treated with.
But even without formal recognition, this little clinic is already the shining light at the end of the tunnel for many residents in Kariobangi North, providing affordable and effective healthcare in the heart of the slum.